Wondering why you're not getting a whole body scan after cancer? This is a really common question. In this video, I'll be talking about the evidence supporting scans, and more in abundance is the evidence explaining why we tend not to do scans after treatment, with some exceptions, of course. Before I go on, I'd love to have you subscribe to our channel. We're always putting out new and updated content, so there's always something new to watch. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. Your Yerbba report takes everything we know about your tumor based on records that you upload or give us access to through your electronic health record, creates a report of everything we know about the cancer, everything that might be offered to you in your upcoming appointments, the pros and cons of each, and also gives you some questions that you can take to your medical team to help engage in a more meaningful, fruitful, and beneficial conversation with your medical team. So why don't we do scans? We just want to make sure that the treatment got everything, that the cancer hasn't come back. It makes perfect sense. We talk about early detection equals cure. Everybody's encouraged to go get their mammogram, to get their colonoscopy, right? We talk about early detection equals cure. In this video, I'll explain why that's not the case with recurrent cancer. I will say it's really important to have breast imaging. That means mammogram or MRIs of remaining breast tissue in your body to detect a local regional recurrence. What I'm talking about now are scans being done in people who have no symptoms. They feel great until they're waiting for their scan, or it's just scheduled for them. It's just sort of automatically told to them that you're going to get scans. We do not recommend this. And the reason is that in the case of cancer that's come back in other parts of your body, and I know this is hard to hear, that early detection does not equal the chance of cure. So finding disease in the liver or the lungs or the bone when you have no symptoms just increases the amount of time that you know you have advanced cancer. Treatment will work no matter when we start. So let's say you are picked up with a scan in April and you would have developed symptoms in June. Treatment will work just as well in June as it would have in April. And you get to live April and May with no treatment, without the side effects, without knowing that you have advanced cancer. And I'm not saying ignorance is bliss, though some people have told me that it is. All I'm saying is without a proven benefit, why would we put people through the stress of a scan, the exposure to radiation from a CT scan or a PET CT, all the anxiety, and then the subsequent tests that get done, because even a negative scan is going to show something abnormal. We all have cysts and parts of our body. We all have abnormal findings. I have seen in my entire career once where the radiologist wrote normal scan. Once, and I've been practicing for a long time. It is really uncommon for the radiologist not to see something that is not, quote, normal, even when it's normal. So in the absence of proven benefit, and with all those harms, and without any proof that a negative scan means you're cancer-free, why do the scans? What about for peace of mind? It's never been shown to improve peace of mind. In other words, a scan doesn't prevent the cancer from coming back. And the key thing is a scan is useful, if it is useful, only when it's positive. When it's positive, meaning there's cancer seen, now I can say, it's very likely your cancer's come back, let's do a biopsy and then start treatment, because it's going to be really hard not to start treatment. It can take a couple months for that whole workup and to actually begin treatment, because biopsies take a while to schedule. If a scan is negative, it doesn't mean the cancer hasn't recurred and just can't be seen. This is a hard topic. Physicians spend a lot of time with you after your treatment, and most people don't really understand why scans aren't being done, which is why we're having this difficult conversation today. I know this is hard to hear. You've done everything that was offered to you, and if you declined certain treatments, you did everything you thought was right. So that's how you want to stay in your best, most confident self, is that I did everything I could. I've done everything to decrease the risk of the cancer coming back. Again, be sure to report any symptoms you have to your medical team. You don't want to get to a place where your cancer has come back and has been neglected. That happens sometimes because people think, well, my scan last month was okay, this can't be cancer. And that's another one of the downsides of scans. I hope this has been helpful. Thank you for watching, and we'll see you next time.